There are several capabilities for a better experience reviewing a completed scan. The occlusogram is the color representation of the contact areas between the arches. The arches in red indicate full contact, and there are 3 scale options available on the scanner. Being able to display the occlusal contact allows the clinician to evaluate the patient's occlusion. The clinician can then educate the patient about their oral conditions with a clear visual aid. The color icon allows the user to toggle between color and monochromatic modes. This applies to both scanning and viewing all case types. If an attachment or other appliance remained in the mouth unintentionally when it should have been removed prior to the scan, it can be removed virtually using the eraser tool to fix that specific area. First, tap the eraser icon, and then using your finger, draw a circle around the large area on the model that includes the content which needs to be removed. It is very important to rotate the model to confirm that the correct content has been removed. Then tap the wand icon and rescan the area. Information required for the Invisalign case type includes the following: 2 mm of gingival tissue, solid incisal edges on both the lower and upper jaw. These scans help to verify that the lingual segments and buccal segments are joined with accurate incisal surfaces. This step is critical for properly fitting Invisalign aligners. The interproximal anatomy is critical for best fit aligners. A record of the bilateral bite from the patient in the relationship the clinician wants to treat or restore the case. Also, review the models from the buccal and lingual. The distal surface of the last present molar should be complete to ensure that the aligner fits properly. Once you confirm that your scan fulfills all the requirements, tap the envelope icon to send the case. Congratulations! You have completed the training video about full mouth scanning natural teeth powered by the iTero Element intraoral scanner, and you are now ready to practice scanning. It starts with iTero.